constantly losing blood at the level of those tiny capillaries because their red blood cell is abnormal because of the sickle. That is it. So that's why it's called sickle cell. When the hemoglobin tries to penetrate through the tiny capillaries, it forms an S sickle shape and breaks.
Okay. Àwọn kan sọ pé bí àwọn machine tó yẹ kó gbé afẹ́fẹ́ lọ síbi àwọn tissues ara fún ẹni tó bá ti ní àìsàn fòníkú-fọ̀ládìde kíni tí wọ́n wà abnormal so kò ní lè gbé afẹ́fẹ́ lọ sí tissue tó yẹ kó ó ti yé wa.
So that's what gives rise to sickle
cell. Oda. What are the signs and symptoms? Àwọn àpẹẹrẹ tá a lè rí tá a fi sọ pé this person has sickle cell.
Now, from what I just explained, I talked about the fact that the blood vessels are blocked by these cells that are broken, and so oxygen is not delivered beyond the point of blockage.
Okay.
That is ischemia translating as pain. That's the commonest thing. Now, nutrients do not go beyond where the blockage is. There is swelling.
Wait, sorry, you mentioned oxygen now. So if oxygen doesn't get to the tissue, nutrients too.
Yes, because it is the blood that carries.
True.
So it doesn't get beyond the point. So both nutrients and oxygen are not supplied beyond those tiny vessels. If you look at your hand now, by the time you press, you discover it is red.
Yes.
The tip is red.
Okay. Yes.
That's because there is blood supplied to those tiny places.
Okay.
Now, at the point when if sickle cell occurs, blood doesn't flow that far in. Then what happens? There is pain in the digits and there is swelling. That's the commonest thing you find in them.
Okay.
Of course, they are malnourished, not because they are not eating, but because they are losing nutrients from those blockages.
And you mentioned that the nutrients will not get to where it should get to.
Yes, they look small for age. Some have big tummies. Why? Now, there are organs in the body that their job is to remove abnormal cells, the liver and the spleen. So for them, they may have enlarged, looking small for age. They are always jaundiced because they keep losing blood cells. So I told you that with breakage becomes increase in production of bilirubin, and that causes the jaundice that appears. So these are the basic symptoms. And then I also told you by laboratory findings now, their blood level is always low because they keep losing on a daily basis. So those are the common symptoms and signs.
Thank you very much for that. Like, you really broke it down for us to be able to understand it. Thank you very much. Kí wọ́n máa ní pain crisis kọ́ máa experience pé ara ń dùn wọ́n torí wípé bọ́n ṣe sọ tẹ́lẹ̀ ibi tí nǹkan tó yẹ kó gbé afẹ́fẹ́ wá sí tissue kò gbé wá because their own machines àwọn nǹkan tó yẹ àwọn èròjà tó wà lára wọn kò ṣiṣẹ́ bó ṣe yẹ kí ẹni tí ò ní sickle cell yìí kó ṣe so ó máa affect wọn also wọ́n tún sọ̀rọ̀ nípa pé èròjà bóyá lára oúnjẹ lára kí ní ṣe pọ̀ blood máa ń wọ́n máa flow àwọn nutrients yẹn náà tá a bá jẹun so because of that abnormalities lára ẹni tó bá ní àìsàn yìí àwọn èròjà oúnjẹ yìí ò ní débi tó yẹ kán dé lára wọn and another thing tó tún sọ̀rọ̀ nípa ni pé and then wọ́n sọ wípé kán tún kéré ju ọjọ́ orí wọn lọ torí wípé àwọn èròjà oúnjẹ kì í ṣe pé wọ́n ń jẹun but torí pé àwọn èròjà ara àwọn oúnjẹ yìí ò débi tó yẹ kó dé lágọ̀ọ́ ara wọn wọ́n dẹ̀ tún ṣàlàyé wípé ara àwọn kan tó ti máa ń ṣiṣẹ́ lágọ̀ọ́ ara wa bíi àwọn tí ò bá ti ní àìsàn yìí bóyá bíi ẹ̀dọ̀ àwọn kan tó yẹ kó tì jáde abnormal cells tán ṣàlàyé lẹ́ẹ̀kan but fún ẹni tó bá ti ní àìsàn yìí lára liver yẹn máa wò pé àwọn cells yìí torí àwọn abnormal cells ló pọ̀jù lára sickle cell ló pọ̀jù lára ẹni tó ní àìsàn yìí so the liver would feel that those cells are abnormal kò yẹ kó wà lágọ̀ọ́ ara and keep fighting them which is why they always have their episodes their crisis so fún ẹni tó bá ti ní àwọn àìsàn fún ẹni tó ti ní àìsàn táwọn sọ̀rọ̀ pẹ̀ lágọ̀ọ́ ara láàárọ̀ tuntun ní àwọn àpẹẹrẹ tán máa ń rí lágọ̀ọ́ ara ẹ̀ nìyẹn tẹ̀wọ́n ṣàlàyé pé blood level wọn ibi tó yẹ kẹ́jẹ́ wọn dé fún àpẹẹrẹ ṣe máa sọ̀rọ̀ pa sugar level blood level tí wọ́n fún ẹni tó bá normal wọ́n máa bí 30 something àbí above but ẹni tó bá ti ní àìsàn fòníkú-fọ̀ládìde lower than 30 ní 20 something and the person looks good is a normal person an adult ni ẹni tó ti dàgbà ní kì í ṣe pé ọmọ kékeré kan ni so fún ẹni tó bá ti ní àìsàn yẹn àwọn àpẹẹrẹ tán máa ń ní òun nìyẹn. Okay, doctor, thank you for that. Now let's superstitions, perspectives about the sickle cell disease and what are they?
Wrong popular beliefs. One.
Spiritual ones too.
You know.
Okay.
Number one, sickle cell is contagious.
Okay.
If you like, hug a sickle cell, sleep with a sickle cell, you won't get it.
Even if you have sexual intercourse with the sickle cell,
you can't get it.
Okay.
It's not contagious. It is genetic.
Abínibíni ṣe.
It
Kì í
is
ṣe pé
genetic.
a lè kó rẹ nìkan àbí a lè kó rẹ lòmíì.
No. And for AA genotype, let me make this passionate appeal now.
For AA genotype.
For the AAs,
Okay.
let me make a passionate appeal. It is AAs.
Okay.
Let me make a passionate appeal. It is you that we expect to marry the SS.
Sorry?
Yes.
You mean that the people that have àwọn tó bá ní genotype AA?
Yes.
Lẹ ẹ̀yin òyìnbó expert àbí sorry ẹ̀yin akọ́ṣẹ́mọṣẹ́ oníṣègùn òyìnbó expect pé kán má rí SS.
Yes.
Kí ló dé?
SS can't marry themselves.
But you know you mentioned now that the episodes that
Marry themselves.
but you know you mentioned now that the episodes that sickle cell people with SS go through. Somebody that now marries somebody who has SS, wouldn't the person have to start managing the person that goes through crisis?
That's where love comes in.
Love.
I have friends
Okay.
who got married to SS and they're doing fine, both husband
But then
and
their
wife.
children are not
Their
SS.
children are not SS.
Okay.
That's the goal. Their
Okay.
children are not SS.
Okay.
Because AA marries SS.
AS.
The highest thing they give rise to is AS.
Okay. Okay.
And like I told you, I am not AA.
Okay.
So somebody I am not AA.
Okay.
So somebody gave birth to me. Gave birth to me. So the duty I owed myself and my generation is to not marry AS or SS.
But then you have to marry AA.
Is
AA.
no, none of my children is SS.
SS. Okay. Okay.
They are AA.
AA. Oh, all of them?
They are AA.
Ooh, all of them.
Okay.
Wow. Okay.
So in my genealogy now,
Okay.
I have eliminated
True.
the S.
True. Okay.
So that is it. Just make sure that you marry. If you are AA, you can marry any of the genotypes.
Okay.
You are free. You can marry AA. You can marry AS. You can marry SS. You are free.
Okay.
But once you are AS like me,
Okay.
please
Okay.
marry AA only.
AA only.
So that you
Ṣé ti
can
gbọ́ bẹ́ẹ̀ yẹn?
eliminate the S.
Okay. Ẹ̀yin tẹ́ bá ti ní genotype AS, tẹ́ ti mọ̀ pé tẹ́ ti lọ sí ilé ìwòsàn tẹ́ ti mọ̀ pé genotype yín AS ni. Wọ́n ti sọ sìn wípé kẹ́ ẹ ya fẹ́ ẹni tó yẹ pé genotype rẹ̀ jẹ́ AA. Ẹ mọ̀ tún fẹ́ A.
You can marry
Ẹ lè
anybody.
fọ́lẹ̀ lè fẹ́ S o, wọ́n lè fẹ́ SS. Wọ́n ní pé ibi tí ìfẹ́ ti wọlé nìyẹn pé ṣe pé SS bá tún go through crisis wọn. You will be there to help them if you marry SS. That's where love comes in.
That's where love comes in.
Okay. Now you mentioned AA marrying and every of
Any
the
of
this
the
thing. Now the other ones that are not common, I want genotype won't common here like AC, CC, SC.
AA can marry.
AA can marry them.
Any one of them.
Hey.
Because once that happens, you will help to eliminate the abnormal hemoglobin with time out of the system.
Okay.
Yes.
Okay. Okay.
So let's go back to the meat quickly.
Meat, yes.
Now we've talked about the fact that it is not a transmissible.
Yes.
It is not infectious.
Ah, le coronyo.
Number two, people do say all the sickle cell people, they can't put number of them.
People who have sickle cell
Yes.
can put to bed.
They can. They are fertile, both male and female.
Female,
I have
okay.
a friend who is a lady
Okay.
who married an SS husband.
Okay.
In fact, they've completed their child line since probably 2020.
Oh. Okay.
Yes.
Wow.
They've had 3 kids and they are doing well.
Wow.
Yes. So the only person that they are taking care of in the house is the father.
Nara, it's not transmissible. It's not something that can be contracted. Wọ́n tún ṣàlàyé wípé the fact pé ẹnìkan ní SS tàbí tó ní àìsàn fòníkúfọ̀lá dìde kò túmọ̀ sí pé wọ́n lè bímọ bóyá yálà ọkùnrin àbóbìnrin tó jẹ́ pé obìnrin ló ní àìsàn nínú wọ́n lè bímọ tó bá yẹ pọ̀ ọkùnrin náà ni ọkùnrin náà lè fún yàn lóyún tó máa bímọ. It's not like pé because they have sickle cell.
Okay, another one is that people that are sickle cell patients, they always seek for medications. It is pain that makes them go for pain relief and analgesia.
Okay.
They are not junkies.
Okay.
They are not junkies. They don't do drugs.
They don't do drugs.
They
They just
don't.
have to use the pain relief
They
because
just
of the
have to
pain
use
crisis.
the pain relief, and once they are fine, they do away with it. So
okay.
they are normal human beings. And guess what? I realized this from my experience. They are brilliant.
I was just about to say that. I've
Most
noticed,
of them.
Yes.
So I always say they compensate here. They are brilliant.
Yes.
If I see anyone amongst them, I always want to stick close to them because I know they are brilliant.
Yes.
I've had to handle issues, and this man was there, and he looked at me, and he saw what I was going through. Afterward, I just said, "Doc, why not try this?" As in, he was about to leave,
Okay.
and he just got up and said, "Why not try it this way?" And he left the
Wow.
consulting room. I thought, "Thank you." And when he left, I continued battling with my system. After a while, I was like, let me even try what he said. Boom.
And it worked.
And it worked.
Wow.
I felt like just running to him to touch his head and say, God bless you. They are very, very brilliant.
Brilliant.
They are brilliant. They are very fantastic people.
True.
If you relate with them, you don't be discriminated. They are just like you and I. Okay? What they are born with is not their fault in any way. So they should not be disadvantaged for any reason. Employ them.
And they should not be discriminated
They
against.
shouldn't be discriminated on any surface or sphere. Employ them.
Okay.
They are just like you and I. I met with one who is a nurse. And then, yes, we work
I know
together.
a medical doctor now.
Very brilliant. Very brilliant. When
sọ pé a lè súnmọ́ wọn, a lè fi wọ́n ṣọ̀rẹ́, a lè bá wọn sọ̀rọ̀, a lè bá wọn ṣeré rárá. Èèyàn bí èmi àti ẹ̀yin náà ni. Wọ́n dẹ̀ máa ń mú ọ̀wé, wọ́n máa ń ní ọpọlọ. Ẹ ṣé dókítà wa. Now, before we come to, because you talked about how to prevent it, you mentioned that. How can it be treated? But before we come to that, let's go on a quick break. When we come back, we'll address them. Please stay with us.
Àyíká wa kó mọ́ tónítóní o. Àlàáfíà tayọ. Jẹun tó dára lásìkò. Àlàáfíà tayọ. Ohun tẹ́yẹ bàjẹ́ lẹ́yẹ ń gbé fòkúrè dé dáná. Àlàáfíà tayọ. Wẹ̀ ní ọmọ kò gbé kọ́nà rẹ̀. Àlàáfíà tayọ.
We increase their blood level. Okay.
Yes, protein food, liver, egg, fish, protein meals. You
I want proteinous food.
Yes, let it be part of their daily feeding. 2, they have to drink water lots because that will make the blood to flow easily and relieve all the blockages in those tiny vessels.
Okay.
So it will also help to relieve the pain. So when you tell an average adult to take 3 liters of water in 24 hours, they go as much as 5 liters.
Okay, so tí a bá sọ pé kí ẹni tó jẹ́ tí ò ní àìsàn fòníkúfọ̀lá dìde yìí kó mu bí lítà 3 omi lójúmọ́. Fún ẹ tó bá ti ní àìsàn fòníkúfọ̀lá dìde ó gbọ́dọ̀ mu bí lítà 5 torí pé wọ́n ní di omi tí wọ́n dáadáa.
To make the blood fluidy, and that's
so you understand what you are saying?
All right, so they eat healthy food, take lots of fruits and drink lots of water.
Okay.
If the pain persists and they take their medications and it's not going, they visit the hospital. Okay. Another thing is they are also prone to malaria. Malaria is one disease that destroys blood cells on a normal day.
Yes.
Now, their blood ordinarily breaks by virtue of movement. They will not have malaria again. That's one of the things that kills them fastest. Because it will break the blood vessels so much the heart goes into failure and they die from heart failure. Yes, so they take their malaria medications when they have to seriously. It's that easy.
So as much as when immediately they start seeing signs and symptoms of malaria, they have to quickly address it.
Address it.
Okay.
Before it gets out of hand. And then follow appointments. We have sickle cell clinics. You should register with one. Follow appointments. You would know if you're doing well because they'll be giving you long appointments. See us in 2 months, see us in 3 months, see us in 6 months. Not see us in 1 week or in 2 weeks' time. Once you start getting long appointments in 6 months, in 1 year,
showing that there's progress.
Yes, there's progress. You're fine, and they live normal. They live normal.
Okay. So àkọ́tí dókítà ti ṣàlàyé fún wa ní pé bó la ṣe lè tọ́jú ẹni tó bá ti ní àìsàn fòníkúfọ̀lá dìde sickle cell disease. Wọ́n dẹ̀ ṣàlàyé wípé ẹ máa mu omi dáadáa. Omi ti yín ju tẹ́ni tí ò ní àìsàn fòníkúfọ̀lá dìde lọ. Ẹ máa mu omi dáadáa. Wọ́n dẹ̀ ṣàlàyé pé ẹ máa jẹ oúnjẹ gidi, ẹ máa jẹ àwọn processed food. Wọ́n ti ṣàlàyé sí pé láǹsán pé pasta. Ẹ máa sá fún fẹ́ni tó bá ti ní àìsàn fòníkúfọ̀lá dìde. Ẹ máa jẹ àwọn pastries. Ẹ máa jẹ oúnjẹ gidi, oúnjẹ tó lè máa ṣara yín lóore, oúnjẹ tó lè èròjà gidi nínú. Ẹ máa jẹ èso, ẹ jẹ ẹ̀fọ́, ẹ máa jẹ àwọn protein ẹja. Èdè ṣe ti báyìí. Àwọn ní àmàlà ẹ̀bà, ẹ máa jẹ àwọn kíní yẹn kó ara yín kó lè ṣe dáadáa, kó lè jí pépé. Ẹ máa rẹ̀ ọlọ́ràá, ẹ sá fún ṣe ti rí fún ẹni tó bá ti ní àìsàn fòníkúfọ̀lá. Fún ẹni tí ò bá láìsàn gan, ẹ̀yin náà mọ̀ sá fún àwọn oúnjẹ tó yẹ kẹ́ ẹ sá fún. Oúnjẹ tí ò ní ṣara yín lóore ẹ mọ̀ sá fún wọn. Ẹ mọ̀ pa máa ń sọ lórí ètò yìí, ó ṣe kókó, ṣe pàtàkì. wọ́n dẹ̀ ṣàlàyé pé ẹ máa ṣeré ìdárayá of course máa ó dèrè ìdárayá tí ò ní ṣe jàǹbá fún ẹni tó bá ti ní àìsàn fòníkú fọ̀ládìde eré ìdárayá náà ó dáa ẹ máa sá fún ibi tí ó pé èrò ti pọ̀ jù crowded places he also mentioned that ẹ máa sá fún ìyẹn náà then ẹ mójútó ara yín ẹ lọ sílé ìwòsàn gbogbo appointment yín kò ní ìka ṣẹ̀ṣẹ̀ tó mọ́ sọ fún ẹni tó bá ti ní àìsàn fòníkú fọ̀ládìde pé kẹ́ ẹ lọ rí dókítà go for your appointment follow the instructions that your doctors give you wọ́n dẹ̀ tún sọ nǹkan kan sìn wípé fún ẹni tó bá ti ní àìsàn fòníkú fọ̀ládìde sickle cell disease tẹ́ ẹ rí àwọn àpẹẹrẹ ibà tẹ́ ti ń rí àìsàn ibà ẹ tètè kẹ́ lè tètè lò kí dókítà kó oògùn fún kẹ́ lè tètè lò torí wípé nǹkan kan ti wà lágọ̀ọ́ ara yín already tí ò ṣiṣẹ́ dáadáa àìsàn ibà tún máa wá hard problem sí ni and it can actually cause death wọ́n sọ́nsìn ó lè lẹ̀mí lọ nítorí náà tó bá ti ń notice àwọn àpẹẹrẹ àìsàn ibà or any other sickness it's very important that you pay attention to it and arrest it on time ẹ jọ̀ọ́ ẹ máa rí dókítà lóòrèkóòrè ó ṣe kókó ṣe pàtàkì all right doctor you've made.
wọ́n mẹ́tà àwọn blood group yẹn.
bẹ́ẹ̀ni.
wọ́n mẹ́tà cs wọ́n ní cs náà wà.
sí lára sc náà sọ.
fa.
sc.
ṣé sc ni.
bẹ́ẹ̀ni sc.
ok combination wo làwọn yẹn lè marry.
ok
tí òfin ní sí ss.
tí òfin ní cs wọ́n ṣàlàyé pé aa náà lè fẹ́ àwọn ṣẹlẹ̀ àwọn cs cc ac aa nìkan náà lè fẹ́ wọn gbọ́dọ̀ fẹ́ as àbí ss aa nìkan náà lè fẹ́ ṣàtìdá ìbéèrè yín sà. ẹ ṣe gan sà wọ́n ṣe sọ tẹ́lẹ̀ náà pé aa lè fẹ́ ẹni tó bá ti wù ó lè fẹ́ as aa lè fẹ́ ac aa lè fẹ́ ss aa lè fẹ́ sc aa lè fẹ́ cc aa torí pé àwọn ni wọ́n lè fẹ́ anybody bọ́sẹ̀ ẹni tó bá ti ní as jọ nítorí ọlọ́run aa nìkan ni kẹ́ mọ́ lépa sọ pé a is wọ́n mọ̀ pé first class ni a ní kẹ́ mọ́ lépa fún ẹni tó bá ti ní as àbí ó ti ní any other kind of genotype bóyá ss àbí sc rather tàbí cc àbí ac aa ní kẹ́ mọ́ lépa ẹjọ́ ó wà very important 0705 500 1033 0905 444 1033 lójú òpó Facebook wa náà àwa ń bẹ̀lẹ̀ wá kìtìkìtì bẹ́ẹ̀ yẹn at I-FLIER 103.3 FM live at I-FLIER 103.3 FM live tẹ́ bá ní ìbéèrè nǹkan tẹ́ bá fẹ́ bi wá láàárọ̀ ti tòní ẹ láǹfààní láti pè wá 103 FM live ẹ já lọ sójú òpó Facebook wa àti rí bí àwọn kọ́mẹ́ǹtì mélòó kan láti ọ̀dọ̀ Pastor Dr. Mukala Famiwa wọ́n ní wọ́n ṣe o àdúpẹ́ lọ́wọ́ yín o wọ́n ní àwọn wò wá láti Ìjẹ̀bú thank you very much for watching from Ìjẹ̀bú wọ́n ní tí wọ́n wá ṣe àìsàn fòníkú fọ̀ládìde tá à ń sọ nípa is talking about diabetes he's asking that what advice can you give to somebody who has diabetes okay and he's saying something else here too he said so does it mean that your married will have to I don't understand. The married will have to, as the partner, if he's AS, ask the partner. Of course, he's asking that if the unmarried will have to ask the partner if he's AS before they go on their courtship. When there is love, love covers all.
Love does not cover all.
Okay. So Jesse Bossy, Doctor Mukala Famiwa, wọ́n ní pé love does not cover all. Lórí ọ̀rọ̀ genotype wo.
Know your genotype before you allow love to come in.
Wọ́n ti ní know your genotype before you allow love to come in.
And there is nothing like love at first sight. Genotype at first sight. Yes. It is genotype at first sight, not love at first sight.
Not love at first sight, genotype at first sight.
I married late.
Okay.
And that's because I'm not exaggerating here. I met 8 ladies who were AS.
Ooh, wow! And you could not marry any of them.
Of course, as a doctor.
Okay.
I kid not.
Okay. Wow.
Of course.
So you have to wait for AA.
So there was nothing called love at first sight. It was genotype.
Genotype at first sight. Okay, let's pick this go. Hello, good morning, Ekaro.
Hello, Afuja.
Yes, sir.
Ṣé mo gbé Dr. Mukala Famiwa náà wà ńbẹ̀?
Àwọn kan náà wà lórí nínú ilé agbára o. Àwọn kan fi question ṣọwọ́ sí wa lójú òkú Facebook ni.
Okay.
Bẹ́ẹ̀ni, sir.
Yes,
sir. Yes, sir. Okay, so Dr. Mukala Famiwa wọ́n ti dáhùn béèrè yín pé of course you are free to marry such a person. Mo mọ̀ wípé àti pé kọ̀ọ̀kan tàbí mi nípa ọ̀rọ̀ genotype torí pé that's the foundation when it comes to we are talking about sickle cell disease àìsàn fòníkú fọ̀ládìde. So the other question that Dr. Mukala Famiwa asked that you should give an advice on what advice you can give to those who have diabetes.
Yes.
Àìsàn tó sugar.
Let me run through that quickly.
Okay.
Diet. Many people don't pay attention to what they eat. But I'll only mention 2 things today: diet and leg work, exercise.
Okay.
Not dance, exercise.
Okay, because when you mention leg work, I say okay.
Diet.
Okay. Diet
What do I mean by
and
diet?
exercise.
For you, if you're diabetic, 1 carbohydrate meal a day, it's okay. It's either rice.
Irú oúnjẹ wo ló yẹ kẹ́ ẹ máa jẹ? Oúnjẹ yẹn ṣe tí ẹni tó bá ti ní àìsàn ìtọ̀ ṣúgà yẹ kó máa jẹ. Watch your food, according to what Dr. Koli has also said. Watch your food, oúnjẹ tẹ̀ ń jẹ àti eré ìdárayá ó ṣe kókó ṣe pàtàkì. Hello, ẹ káàárọ̀ o.
Hello, ẹ káàárọ̀.
Ẹ káàárọ̀ mà.
Yes, sir.
Kí lorúkọ yín, bó lẹ ti ń pè mà?
Hello.
Hello mà, kí lorúkọ yín mà?
Felix láti Kire.
Okay, ẹ káàbọ̀ mà.
Ẹ dákun, a fẹ́ kí dókítà bá wa sọ̀rọ̀ nípa àwọn tó bá ní IBP. Kí làwọn mayors tí wọ́n gbọ́dọ̀ máa tè.
Ó dáa.
Àti tí wọ́n ń polówó àwọn oògùn kan fún wa ní ìfẹ́ dákọ̀ rẹ̀.
Ẹ má dákọ̀.
Polówó àwọn òwò.
Ṣé ilé ìwòsàn láti polówó ẹ̀ fún yín àbí bo?
Nílé ìwòsàn ni.
Ṣé dókítà ló sọ fún yín?
Dókítà ni ná.
Okay.
Bọ̀ ó jáwọ́ oògùn tó ń wọ̀n ni wọ́n ní kinní kan ẹ̀ mú lọ parí rẹ̀.
Tọ́.
Yóò sì yé dókítà báwọn.
Ó dáa, ẹ jẹ́ kí dókítà sáré ṣàlàyé yẹn.
Smartwatch, or just use your normal
Phone, yes.
And then you check 15 minutes, you track, work out anywhere you get to. After 15 minutes, walk back home. 15 plus 15,
30 minutes and you're fine.
And you are fine. So in doing that, you are able to maintain your weight. The lesser the weight drops, the BP thing becomes a thing of time. It would go away.
Okay.
With your medications, they respond better. Some people say, I use this drug, it's not working. Now, some people will tell you they have arthritis. For such persons, you know they can't do walking. So at that point, you can only deal with what? Dietary control. When you see some people eat, you will be afraid.
Okay.
The volume of things they download is afraid.
Okay.
It's scary. Reduce your carbohydrate. Then you reduce your carbohydrate. Do away with soft drinks. When I see elderly people taking soft drink, I feel like, are you guys normal?
Okay. For those who are already old,
do away with soft drinks.
Everyone too, basically.
Leave it for children.
There are people who are already these ambassadors for these soft drinks. They drink it every day.
Please do it.
We know somebody every day.
Leave it for children. One of my senior staff in the office was complaining about the fact that her child is energetic, and anything she eats, before she knows, she will come back and say, "Mommy, I'm hungry." I'll be like, "Okay, you know what? Let me tell you now." I said, "Watch her.